Hi everyone. I am just going to do a series of mini lectures throughout the rest of the course to just kind of go over medications that can be kind of hard to understand. And I have always been a big believer that if you understand physiology and the areas of the body that a medication is supposed to work on, you're going to understand the pharmacology a little more. So I wanted to talk to you guys about the medications behind growing basically red blood cells. So if you look at this figure, which you see in your book, this is going to talk about how we can use growth hormones to stimulate red blood cell use. So really quick, as you guys all know, we have blood cells all over our body, right? We have white blood cells, red blood cells, and platelets. So this chapter, or chapter 32, it talks about, medications that we use to enhance erythrocytes, which is our red blood cells, leukocytes, our white blood cells, and platelets. So this next few minutes, we're going to talk mainly about our red blood cells. So when you look at this this chart, you're going to see basically the start of where red blood cells are formed. So red blood cells are formed with blood cells are formed during hematopoiesis, and that occurs in the bone marrow. And you're going to need vitamins B, C, copper, iron, and other nutrients. So as we know, that when we are deficient in those areas, we can have trouble making our blood cells, right? So if somebody's vitamin B12 and folate deficient, you have a macrocytosis. And for those who are iron deficient, you're going to have a microcytosis. So as you can see here, in the red bone marrow, you have the pluripotent cells, which are the basic stem cells, and they are going to split off into three different cells. So there's the megakaryoblast, which will later become platelets, the leukocyte stem cells, which, as we know, will become white blood cells, and then the proerythroblasts, which will, of course, become erythropoietin. So when we talk about red blood cells, there are reticulocytes, and erythropoietin is the growth stimulating factor that will then generate the erythrocytes. So colony stimulating factors are actually secreted by your leukocytes, and they are what are going to stimulate erythropoietin. So we have recombinant DNA technology that helps stimulate our red blood cell when we have some sort of deficiency in our body. So the management of hematopoietic diseases are often involved by replacing the substance we're deficient in, right? So if somebody has a malabsorptive issue and they're B12 and folate deficient, we can give them B12 injections, or we can give someone folate. If they have a disease known as pernicious anemia and they don't make intrinsic factor, they have they're B12 deficient, so we give them intrinsic factor. If someone's iron deficient, we will replace them with iron. Well, for some reasons, you can have a deficiency in making the colony stimulating factor to convert the reticulocytes into erythrocytes, then you need to replace that. So there's the drug called epoetin alpha, also known as Epogen or Procrit. They're quite expensive but helpful. They're identical to the natural hormone erythropoietin, and it will stimulate the production of red blood cells in the exact same manner that we just discussed here in this chart. So the reason why this is so important is when somebody is getting chemotherapy, it is suppressing rapid cell division in all aspects of the body. Now, Chemo has come a long way in the last 15 years, and it is becoming more and more specific, but most anti-neoplastic drugs are going to be toxic to the bone marrow. So you will have a dramatic reduction in circulating erythrocytes due to the fact that you do not have as much the pluripotent stem cells. So you need to enhance what you have by sending out more erythropoietin. So hematopoietin drugs are used to boost blood cell count in general, and we are now going to talk about the hematopoietin growth factors and enhancers in pharmacology. So here is the feedback loop talking about the mechanism of erythropoietin. So in homeostasis, meaning everything's going fine, you have a normal blood oxygen level. When that goes down, for whatever reason, maybe you are anemic due to iron deficiency anemia, or you are slowly over time reducing the blood flow to your kidneys due to decreased perfusion, so hypertension, diabetes. For whatever reason, you have these reduced oxygen levels. So that is going to stimulate your kidney to release erythropoietin. The erythropoietin is then going to get, so there's this, and it's going to say, I can't breathe. It reduces the erythropoietin, and it stimulates your bone marrow to create, or to start erythropoiesis and increase the red blood cells circulating. So then you'll have more red blood cells to carry heme and oxygen and to circulate more oxygen to the body. Okay, so when discussing why we are using EPO medications, so, in patients with CKD, this can avoid the use of drug transfusions or blood transfusions, which we want to avoid those who have heart failure. And also, like we mentioned before, in chemotherapy, they use this with children who are born early. But the main thing about EPOs you can see here is if you look at these arrows, what it's showing you is that, like right here, you're going to increase red blood cells and oxygenation to wound. It's going to protect the eyes, obviously, because you're increasing circulation. Again, increasing circulation to the kidneys and to the blood. Angiogenesis, which is the ability for vessels or organs to make their to increase their vascularity. So it's going to improve oxygen flow, and that's important for brain development of a fetus. And then EPO leads to more erythropoiesis, so development of red blood cells. There's cardioprotection and vascular protection because, again, of the angiogenesis. But something that's important for people to understand is that there are safety issues, right, that are going to be involved when you increase someone's erythropoietin. So this is going to help you understand the side effects. So first of all, okay, hypersensitivity, we know that. Those are the stage 1 reactions. But it can also increase blood pressure, partially because of the elevated blood viscosity, and also the reversal of hypoxia-induced vasodilation that can happen when you increase the hemoglobin concentration. So those with the non-renal anemia tend to not have that hypertension from erythropoietin agents, but those who are getting it because they're on dialysis are at higher risk for the hypertension and for the viscosity, increased viscosity of the blood. Again, because you have increased viscosity of the blood, you have an incidence of thromboembolism and the risk of cardiovascular events, including a heart attack. One thing that's really important to understand too, we talked about that angiogenesis, meaning you're going to help increase blood flow. So you can actually stimulate tumor growth because the cancer cells tend to lack functional um, erythropoietin protein, and then you're providing this erythropoietin, and you're going to stimulate angiogenesis to a tumor, meaning you're going to provide improved blood flow to the tumor. So you have to be careful about that. So this slide shows you some of the positives and negatives with the EPO. So as you can see, you have the hematopoiesis, and you're going to improve the immune system and some cardiovascular effects. However, remember, you're going to have prothrombotic effects, so you're going to increase platelet aggregation and thrombosis. And you could also increase immunomodulator effect, so you could have some effects on inflammation on the body. And then direct tumor effects, as you can see, this talks about how you are increasing vascularity, angiogenesis, which will allow for metastasis, and also apoptosis resistance, which is the ability for tumor to be strong in its cell death, and you don't want that. So back to just going over really quickly with erythropoietin. This is just a small lecture just on how I like to break down medications for you to understand why we give it and how we give it and what to look for. So it can be given subcutaneously or IV. And of course, you're going to look for those adverse effects. So side effects, you can get headache, fever, nausea, upper respiratory infection. So look for those. And then serious effects, are the hypertension, seizure, thrombotic events, heart failure, MI, and stroke. And when you are administering it, you want to make sure you know about all other possible drugs. There can be possible interactions with those that increase thrombotic events. You are going to, they're going to monitor H&H, red blood cell count, ADLs, and PT INRs. Blood pressures will be taken because of the risk for hypertension, and of course when to come back in for side effects. And then in order to minimize adverse effects, you are going to teach patients, family, and caregivers how to monitor pulse and blood pressures. So that's just kind of a little piece on erythropoietin. And I hope you enjoyed this mini lecture. I know that pharmacology right now, especially since this is a non-prescribers class, it's just about basics and understanding, but I'd love some feedback and to see if there's anything I can do to enhance knowledge on different medications.